Mahatma Gandhi once said, "The best way to find yourself is to lose yourself in the service of others." And this quote took a direct correspondence to me, as the happiness of others soon became a fuel for me to find the purpose that I've scoured for. Greetings, class. Professor Moreno. Over the course of the next few minutes, we're going to be going over what a physical therapist is, what are some requirements to be a physical therapist, and what are some pros and cons to being a physical therapist. The term physical therapist is defined as someone who treats disease, injury, or deformity through exercise, heat therapy, or body manipulations, rather than through the use of drugs or surgeries. I'll be required to help with any of their prior injuries, prior surgeries, or if any of them just have health conditions, and we'll be working on improving their quality of life. I'll also be developing plans of care, diagnosing any of their issues based on their body movements, and use exercise, electrical stimulation, and hands-on therapies in order to help regain some of their mobilization as well. Many of the necessary skills involved will require an innate ability to have empathy for a patient, as many of them are going to be on the spectrum of either depressed or sad that they're in this state and they need physical therapy, or angry that they're just not getting better on their own. Will need to be dexterous, as physical therapy is a hands-on type of career. And you'll need to have creative problem solving, because just because someone comes in with the same injury as someone else, it doesn't mean that they're going to have the exact same therapy assessment or the same exercise regimen. The salary on the lower end is about $75,000 a year. Those are typically the newer physical therapists in the field. And the higher end is typically about $106,000, but those are the ones with either more qualifications or have just been in the field longer. However, the scale has been increasing over the course of the last 12 years, and it looks like it's going to continue to increase. When I go through my grad school rotation, I'll be going through different clinics, and I'll be able to get a sense of what type of physical therapist I want to be, whether I want to be in a research lab, or if I want to be in a clinic or a home therapy type of setting. Preparation-wise, luckily, it's actually pretty straightforward. I'm working on my kinesiology undergrad, and typically you want a some type of science bachelor's degree so that it just kind of helps correlate to being a physical therapist a little bit better. Once I'm done with my bachelor's degree, then you apply to a 3-year program. Sometimes you can get into the accelerated grad school program, but typically it takes about 3 years. And then you'll need to pass a national physical therapy exam, as well as a state licensure exam. I'm currently a physical therapy aide already at a clinic, and so I'm already one step ahead, as a major prerequisite is hours in the field. To pretty much move to what can get me more skill, there are a few outstanding qualifications that I can work with. I can either go with a clinical residency or a clinical fellowship, and these will offer me more advanced knowledge to subcategories such as temporal mandibular joint, or TMJ. You've got vertigo, as well as a few examples for more specialty routes. I know that once I'm done with grad school and I start to get my feet wet in that environment, I know that I'll choose that specialty when the time comes, and I choose one that I'm truly fond of. As for some advantages and disadvantages, first, primary advantages, which is a major cause for me to choose this type of field, is that I get to work hands-on with people and watch them slowly recover from their injury. Aside from job satisfaction, the working hours are generally up to a physical therapist's discretion, as they don't tend to need to work at one clinic. They can work at multiple clinics, or completely up to them. But as far as hours, it's generally not too exhausting. To rise up the ranks, you generally need to be able to work with qualifications or work with management, so becoming a director of the clinic. For disadvantages, it's actually pretty demanding mentally, and so it can be pretty exhausting. But for the most part, though, there really aren't any disadvantages to it. The more I talk about being a physical therapist, the more I know that it is my calling. With the knowledge of exercise sciences noodling around in my head, as well as the expertise and the refinement of my knowledge in the field, I know that it's going to be great for me. There truly isn't another option for me. In conclusion, physical therapy is a career that corresponds directly to me as a person, and as well as the skills that I've obtained throughout the years. I know that it is from the duties and from the pros and cons, all these requirements are truly going to be for me. And as far as I believe, it's up to me to take true control, and I'm truly happy for that. That I've found my one calling. So thank you all, and take care.